am the holder of the BPI Fundação Caixa share in health economics. This share helps develop the research in health economics at our department. We cover several topics. One of the important ones is access to health care, where in that research topic we try to address the issues that lie behind access to health care by people, identifying vulnerable populations and barriers they face in accessing health care. And the point here is to understand from those barriers which ones can be turned into action points by policymakers and by organizations so that they can improve that access to health care. A second topic that we cover in our research teams is currently how the pandemic is changing the organization of healthcare, how teams are evolving in the way they work, and how can we turn permanently into changes that are in the system, things that were accepted and that were done during the pandemic. We saw temporary changes that improve access to healthcare and the delivery of healthcare to patients that were not accepted before the pandemic. And the issue is, without emergency situation, can those systems or those mechanisms that were created be turned into something that flows naturally into the health system or not? That's a second topic that obviously is important and related to the first one. The third element that we address in our research is aging. We know that aging is an important topic in most of the Western societies and all over the world actually, and most of the time elderly population is associated with more expenditure and financial pressure on the health systems. Here we take a very different view. We take the elderly population as someone that will have specific needs and it will need different challenges to be tackled. It's more an organizational challenge in that those people will want to be taken care according to their preferences and needs and in a very different way that health systems have been doing so far. And understanding all these three topics will help us to propose and develop ideas that will hopefully help policymakers and institutions to improve access and delivery of healthcare.